Now in Better Health, we take a look at the before school checks available to the community thanks to the Southern District Health Board.
Lovely to meet you, and thank you for coming along. Really happy that you've come along.
So my name's Donya Freeman. I'm a public health nurse, and as part of the public health nurse role, we do the before school checks, which is the 8th and final well child check.
I'm Victoria Bryant, and I'm the charge nurse of the public health nursing service here in Otago, and also coordinate the before school checks.
The basics of it, it's where a parent or parents come along with their 4-year-old, so it's a 4-year-old check. And it can be a child that's just turned 4 or closer to 5. It's better if it's closer to 4 though. And they come along and we do a fairly comprehensive health and development check.
And it's a check to see if they're ready for school. It's a free check. It's provided firstly by the vision hearing testers often in the preschool, so they'll be checking to see that your child can hear and see okay, and then it's followed on by an invitation by a registered nurse to do the actual developmental and well child assessment.
It's also an opportunity where we can have a conversation with parents and discuss and promote health, give advice on development and health of a child.
Oh, well, they checked his height and his weight, and they also looked at his, went over all the results from his vision tests and his hearing tests, and did a bit of drawing, looked at the way he's writing, and just this overall kind of look at him, and that was actually really good for me to know that he's going okay and he's doing what he's meant to be doing, and asking if I had any concerns, was I picking up something, and that's really nice. I felt really, I suppose, empowered that he's doing well and he's going to be ready for school, and if not, that they're going to help me and follow up on those things.
We get to sit with the child and do a lot of play. What we're actually doing in that is doing an assessment on the child, where might get them to do some drawing, and through that and through conversations with the child as well, you get to see how they hold their pencil. Some of the younger ones, the ones that are more closer to 4 years old, have perhaps still got a bit of a grip happening, and through that we're having a conversation with the child, and you get to learn lots through conversation. And one of the things is their speech, get an idea of developmentally where they're at with their speech as well, and if we feel that there's any concerns there at all, then we can give some advice to the parents. We've got some really, really good advice that we can give, and there's heaps that parents can actually do themselves. It's just knowing. So if we feel that that child needs a wee bit more support, then we can refer on to a speech language therapist, for example.
So it's quite comprehensive. It covers everything from oral health, immunisation, growth and height, questions that parents might have about the child's development, and just a general kind of discussion around readiness for school.
What was really lovely is that the nurse that interviewed me and took us through the before school check was really, really friendly, and made my son feel really welcome, and because he can be a bit stubborn at times, and so she had lots of ways of encouraging him to do certain activities, and that was really great to be able to sit back and allow that to happen and know that he's absolutely happy and content, and she was checking all the way through.
And sometimes they have questions that they wait until they get to the check and have things clarified, but often it's just that reassurance and an opportunity to talk about other things as well.
So if the parent identifies any health issues that they would like to follow up on, then obviously we work closely with their GP in the first instance, and then we would work together to identify who might be the best services to support them.
So yeah, a little bit apprehensive, but pleased that I was doing this for my son and making sure that everything was checked off before he went to school.
Sometimes we coordinate plans for them to go into school, so making sure if they have got a known health condition like diabetes, for instance, that transition happens as smoothly as possible, and that the child can start school alongside all of the other children and enjoy school.
We're not there to judge at all. We're there to give the support that any family might need, and we're there to help. Yep, so I'd encourage them to pick up the phone, make the appointment, come see us, and if they have got a concern, like make that one of the first things you talk about. I'm really bit hesitant about being here, and we can clarify why that is.
It's definitely harmless and painless, and it's actually really encouraging, and it's encouraging as a parent to come along and feel that you're doing something really good for your child, and that there's other services and supports out there that are going to help you if there's areas that you need to work on. So definitely encourage other parents to come along. I think it's important we're lucky that it's a service free for these kids before they hit school, and it helps not only the parents but the school systems as well. So it's great.
The before school checks give parents a chance to discuss their children's health and development with a nurse. We know that preschool children are at a crucial stage of their development. By getting in early and identifying how kids are doing before they enter school, we can make sure that they get the help they need to participate to their full ability.